If you're caring for someone with dementia, you probably can't remember the last time you were off duty. Not the last time you slept or ate a meal sitting down, the last time you weren't listening for them, watching for them, ready to get up the second something happened. You love them and you are exhausted. Both of these things can be true at the same time. Hi, I am Rupal. I'm a registered nurse with experience in hospice and palliative care, and I help families understand their care options during a serious illness. Today, I want to talk about what a hospice team can actually do for someone living with dementia and for the family caring for them. Why does this matter? When someone has dementia, the care can become constant. They may not remember to swallow their food, so meals can take a long time. They may not be able to follow what you say. They may wander and try to leave the house. You're watching for falls. You're keeping sharp objects out of their reach. You're bathing them, you're changing them, turning them in the bed so they don't get bed sores, changing diapers when they become incontinent of bowel and bladder. It's a constant effort just to keep them safe. Families do all of this because they love their person, their loved one. But being on call 24 hours a day takes a lot out of you. So how hospice can help at home? If your loved one is living at home, hospice can become an additional layer of care. A hospice nurse can visit and notice changes that may need attention, like possible signs of urinary tract infection, a bed sore, or pneumonia before things get worse. The team may help coordinate treatment right there at home, like oral antibiotics, wound care for existing wounds, teaching family prevention methods to avoid new bed sores from coming. That can prevent an exhausting hospital trip and help keep your loved one more comfortable where they are. Hospice can also arrange for a nursing aide to help with bathing, feeding, changing clothes, cleaning, making the bed, brushing teeth or hair, and other daily care. How often they come depends on your loved one's needs, your needs, and the hospice company's staffing ability. Some families get help once a week. Others can get up to 5 times a week. Some weeks will be busier than others. The point is that you're getting support and a chance to take a break. If music therapist is part of hospice team, they can come and play live music, which can be very soothing for patient and family, especially playing the songs that the patient loved. Chaplain can come and do prayer and provide spiritual support to families. Hospice can also send a social worker or a volunteer to sit with your loved one while you run an errand, rest, or take care of yourself. Respite care, remember one of the care level that we had discussed in prior episodes. That respite care can be coordinated with your hospice team so that you can attend a social event or plan a short trip without worrying about your loved one's safety. Taking a break is not giving up. Now, a lot of families feel guilty about this part. Asking for help, taking a break, somewhere in there they start to feel like it means that they are tired of their loved one. And that's not what it means. Taking a break does not mean you love them any less. It simply means you need time to replenish your energy. That's it. You're asking for help because you love your family member who is living with this horrible disease, not because you are tired of them. Hospice is there as an additional layer of care to give you a break. Please don't miss it. Call hospice as early as you can because you want all the help you can get so your loved one can stay comfortable for as long as they live. Hospice in nursing homes and memory care units, they are very similar. Sometimes there just isn't enough support at home. Maybe you physically cannot provide care 24 hours a day. So placing your loved one in a nursing home or a memory care unit does not mean you're giving up. If you don't have enough support at home, that placement can actually be a favor to your loved one. And hospice can start there too. That way you can go back to being a family instead of being the caregiver every minute of the day trying to manage everything on your own. When you are with your loved one and you are not exhausted from giving bath, feeding, etc., you are able to be the spouse or a son or a daughter or a grandkid and spend quality time with them. For example, play the music they used to love. Look at the pictures together. Bring their favorite blanket or a pillow or a plush animal so that they can feel comfortable. Do the small things they always enjoyed. The feeling of the lotion on their hands and feet, the sound of shuffling a deck of cards, sitting outside with you to hear the rain and smell the soil with it. Even if they don't respond the way they used to, those moments still matter. Let the nursing home handle the daily care. Let the hospice team do what they do best. And let yourself just be their family member again. If your family is somewhere in this and it still feels unclear what stage you are in, what to ask for, when to call, sometimes it helps to talk it through with someone who understands how these situations tend to unfold. That's something I do with families one-on-one, helping you understand what you're seeing and what questions to ask next. If that would help, there is a link below. And if this was helpful, share it with a family member or caregiver who needs to hear it. Subscribe if you haven't. I post every week. I hope this helps. Please write any questions you have in this comment, and I will do my best to answer. In the next few episodes, we will look at more examples where a hospice care team can be helpful. See you in the next one.